Let's talk about one of the most common yet least talked about pains of pregnancy and postpartum life: hemorrhoids. If you're clicking on this, you're probably dealing with this right now. And I want to start by saying two things. First, you are absolutely not alone. It's a very common issue, with some studies showing it affects about 30 to 40% of pregnant women. Second, there is a clear, practical game plan to get relief, and that's exactly what we're going to build together. Hemorrhoids are more than just a physical discomfort. It can be embarrassing and make you feel isolated. But it's a normal medical issue, and we're going to tackle it head on with practical, safe, and effective strategies. We'll cover what causes them, how to stop them from getting worse, how to treat the ones you have, and what to expect during your postpartum recovery. This is your survival guide. All right, so what even are hemorrhoids? The simplest way to think about them is as swollen veins, similar to varicose veins, but located in and around your rectum and anus. They can be internal, inside your rectum, or external, under the skin around your anus. The symptoms can range from annoying to downright agonizing: itching, burning, pain, and sometimes seeing blood on the toilet paper, especially when you wipe. So why are they such an uninvited guest during pregnancy? It's really a perfect storm of hormonal and physical changes. First, your body is flooded with the hormone progesterone. While progesterone is essential for a healthy pregnancy, it has a side effect. It relaxes the walls of your veins, making them more likely to swell. It also slows down your digestive tract, which is a major contributor to our next point: constipation. Second, let's talk about constipation. When your digestion slows down, your stool can become harder and more difficult to pass. This leads to straining on the toilet, and that straining puts a massive amount of pressure on the veins in your rectum, causing them to bulge and turn into hemorrhoids. This is, without a doubt, one of the biggest triggers. And third is the simple physics of pregnancy. As your uterus grows, it puts a huge amount of pressure on the veins in your lower body, especially the large veins that return blood from your legs and pelvis. This increased pressure can cause blood to pool and the veins to swell. This pressure is most intense during the third trimester, which is when many people first experience hemorrhoids. And just when you think you're in the clear, labor and delivery can be the final trigger. The intense pushing during labor can cause hemorrhoids to develop or make existing ones much worse, which is why they are also incredibly common in the postpartum period. Now, for the most important part, what can you actually do about it? The best strategy is a two-part approach: aggressive prevention to stop them from forming or getting worse, and gentle, effective treatment for the symptoms you're already feeling. The absolute number one goal in preventing hemorrhoids is to avoid constipation. If you can keep your stools soft and easy to pass, you eliminate the straining that causes them. Here's your prevention checklist. 1. Fiber, fiber, fiber. You need to be aiming for about 25 to 30 grams of fiber every single day. Think fruits, vegetables, whole grains, beans, and legumes. If you struggle to get enough through diet alone, talk to your doctor about a pregnancy-safe fiber supplement. 2. Hydration is key. Water softens your stool, making it easier to pass. A good general target is to drink plenty of fluids throughout the day, often around 8 to 12 cups. The goal is to keep your body well hydrated. Keep a water bottle with you at all times. 3. Rethink your toilet habits. This one is critical. When you feel the urge to go, go. Don't hold it in, as that can make constipation worse. But just as important, don't linger on the toilet. No scrolling on your phone. Sitting on the toilet for long periods puts direct pressure on your rectal veins. 4. Keep moving. Regular, gentle exercise is fantastic for stimulating your bowels and improving circulation. Even a 20 to 30-minute walk each day can make a huge difference. Try to avoid sitting or standing for long stretches of time. 5. Adjust your position. When you're resting or sleeping, try to lie on your left side. This position can take some pressure off the large vein that carries blood from the lower half of your body, which can improve blood flow and reduce swelling. When you do have to sit, consider a donut-shaped pillow to relieve direct pressure. If you're already in pain, here is your toolkit for safe, immediate relief. 1. Sitz baths. This is your new best friend. A sitz bath is just a shallow bath of warm water that you sit in for 10 to 15 minutes, a few times a day. The warm water soothes the area, increases blood flow, and can help relieve pain. You don't need to add anything to the water. Warm water alone is incredibly effective. 2. Witch hazel pads. These are medicated cooling pads that are a lifesaver for itching and swelling. You can get them at any pharmacy. Gently wipe with them after a bowel movement, or you can even fold one and leave it in place for a cooling compress. Pro tip, storing them in the refrigerator makes them even more soothing. 3. Cold compresses. For bad flare-ups with a lot of swelling, applying a cold pack or an ice pack wrapped in a cloth to the area for about 10 to 20 minutes can provide amazing relief. 4. Gentle hygiene. Aggressive wiping with dry toilet paper will only make things worse. Use soft, unscented toilet paper, or even better, unscented wet wipes. A peri bottle filled with warm water is also a great way to cleanse the area without any friction. Always pat the area dry gently, never rub. 5. Talk to your doctor about over-the-counter options. There are creams and suppositories available that can help, but it is absolutely essential that you talk to your doctor or midwife before using any medication during pregnancy or breastfeeding. They can recommend a product that is safe for you and your baby. For many, the hemorrhoid journey doesn't end with delivery. As we mentioned, the pushing during labor can often be the main event that triggers them. The good news is that for most people, postpartum hemorrhoids start to improve significantly soon after birth. Many find they get much better within a few days or weeks. The care strategies are the same as during pregnancy. Continue with the sitz baths, witch hazel pads, cold packs, and gentle hygiene. Keep focusing on a high-fiber diet and lots of water to prevent postpartum constipation, which is common due to hormonal shifts and pain medications. One key difference postpartum is that you may be able to take oral pain relievers like ibuprofen, which can help with pain and inflammation. However, you must confirm with your healthcare provider that it is safe for you, especially if you are breastfeeding. Be patient with your body. It has gone through something monumental. Most hemorrhoids will resolve on their own with a little time and care. While most hemorrhoids can be managed at home, there are certain red flags that mean you need to contact your doctor or midwife. 1. Any rectal bleeding. While minor bleeding on the toilet paper can be a normal symptom of hemorrhoids, you should always report it to your provider to rule out any other causes. It's always better to be safe. 2. Severe or worsening pain. If the pain is intense, getting worse instead of better, or if you feel a sudden, hard, and extremely tender lump, you could have what's called a thrombosed hemorrhoid. That's a blood clot in the hemorrhoid and requires medical attention. 3. If at-home treatments aren't working. If you've been consistent with your home care for over a week and you're not getting any relief, it's time to check in. Your provider can offer prescription strength options or make sure nothing else is going on. And please, never try any new medication, cream, or supplement without getting your provider's approval first. Navigating hemorrhoids during pregnancy and postpartum is a challenge, but it's definitely a manageable one. The most important things to remember are: focus relentlessly on preventing constipation, be gentle with yourself and the affected area, and use soothing treatments like sitz baths and witch hazel for relief. Most importantly, please know that this is an incredibly common part of the journey to motherhood. There is no shame in it, and you do not have to suffer in silence. Talk to your provider, talk to your friends who are moms. You will be surprised how many of them will say, "Oh, me too." If you found this video helpful, please give it a thumbs up and consider subscribing for more practical, evidence-based pregnancy and postpartum advice. And if you know another expectant parent who could use this survival guide, please share it with them. You've got this.